So here at Basic, we offer a conservative treatment known as spinal decompression. And we buy some of the best equipment on the market. This is the Hill DT, which is our spinal decompression table. We have two. As you see, one of our patients is doing a cervical or neck decompression treatment. So basically how it works is patient will come in, they'll have a disc herniation that we've identified the level, and when we find that level, we can basically, with strategic it's almost sniper specific, we can isolate the level of the disc herniation. So we're very specific in our treatment. And basically what happens is when a patient presents to this office, they will have a disc herniation. And if you can see this little red material, this is part of the disc. So when this disc that has become weakened, it has protruded out, and it's called a disc herniation that's encroaching upon this nerve root, okay, or in the IVF. This pressure that the disc puts on the nerve will cause pain, muscle spasms. A lot of times patients will have pain down their arm and into their hand. Sometimes they can have weakness. Another classic typical sign is they'll have pain down their leg, numbness, tingling, like ants crawling. They'll have weakness there. So it's a non-surgical conservative option. And typically what this table will do is the treatment ranges about 27.5 minutes, and the table will slowly pull the vertebra apart at 1.5 minutes. So the first pull is about 1 minute, and then the next 30 seconds it will slowly pull back. It goes out for 1 minute and back, about 17 pulls within that 27.5 minute treatment time. Typically patients here at Basic between 6 to 10 weeks, depending how many visits they come in a week. Everyone's schedule is different. With decompression, we offer physical therapy for strengthening exercises. We offer chiropractic treatment, which is specific spinal manipulation. We do ultrasound and other various manual therapy or massage therapy type techniques to allow the body to heal. We also put you on a very high-end glucosamine with MSM product with a lot of water. So discs basically is about 80% water. So with this spinal specific movement that the decompression table offers us, and you couple that with the glucosamine and the water, you're doing an imbibition osmosis, which you're imbibing or pulling the fluid out, osmosis pumping out. So you're getting rid of some of the lactic acid and toxins in here, and you're pulling in nutrients to help rehydrate the disc, thus increasing the size of the disc, and that takes the pressure off that nerve root. So you see here that this patient's on the neck decompression time. What I'm going to do is I'm going to show you the low back. So basically the Hill DT has a belt system, and we can strap the patient in. Typically it looks like this. And then there's another belt that straps over the patient like this. And that straps you in. And with the computer, I can pick from 1 to 8 programs, okay? So an example is if I pick program 4, I could set the angle. So that pelvic angle down there, I can move that angle up 5 degrees at a time. So once I've evaluated your MRI and you have a disc herniation at L5S1, I can isolate the level specifically to that vertebra and that disc. And then I come over here and I can set the force. And the force is the pull, and then it returns. It pulls and it returns. And I could set that time as well. Typically, there's no pain associated with this. When the patient gets off, they're feeling relief. A lot of the symptoms of the numbness and tingling starts to resolve, and then they can go into the physical therapy department and start their exercises. And when they're done with their exercises, they typically receive a light manipulation to that area, and they book their next appointment. So the Hill DT table has been an amazing alternative therapy for people who are not interested in a surgical intervention.